The phase 3 randomized study CheckMate 067 compared nivolumab alone or nivolumab plus ipilimumab against ipilimumab in patients with melanoma, metastatic melanoma in the first-line treatment. 945 patients were recruited into these studies and randomized 1:1:1, stratified according to PD-L1 status, sites of metastases, and BRAF status. Patients were, in terms of age, gender, well balanced. And really, for the first time, the results today were presented. Primary endpoint here was the progression-free survival, secondary endpoints, overall survival based on PD-L1 status, and response rates and side effect profile. In terms of the primary endpoint, progression-free survival, we could see for the combination, the nivolumab plus ipilimumab, the progression-free survival was around 12 months. The nivolumab alone arm had a progression-free survival of about 8 months, and ipilimumab around 3 months. So significant improvement for the combination with a hazard ratio of 0.79, so 21% risk reduction for patients receiving the combination compared to ipilimumab alone. So this was really interesting. As you may know, and the community has reported lots of immunotherapy trials here at ASCO. Lots of talk is about the biomarker PD-L1 and whether this predicts response or survival benefit. This study was actually looked into this upfront, into PD-L1 status, but couldn't really, for the progression-free survival endpoint, show that there was a significant difference between PD-L1 expression and outcome, especially for the nivolumab, ipilimumab, or nivolumab arm. In terms of response, PD-L1 was significant, so patients who had PD-L1 positive tumors had response rates around 70% versus 50% for patients who were negative. I think the jury for melanoma in this case is still out. We have just seen reports in squamous cell lung cancer where the PD-L1 status was certainly more predictive than here in this case. One key is to mention, although the progression-free survival was significantly of benefit, the toxicity profile for the combination was certainly higher. The grade 3 and higher toxicities were around 50%, quite significantly higher compared to nivolumab alone or the ipilimumab. Important is to mention that there were no treatment-related deaths. And again, this is for the community, something we need to acknowledge and probably taper and understand better how we manage these toxicity profiles. Remember, this is a phase 3 study where as well centers were involved where the kind of management of toxicity side effects may have not been as strictly followed as in more earlier disease centers. So overall, really exciting results and really a paradigm shift. The first time that double immunotherapy combination is superior to the ipilimumab standard therapy, and really from today on, we should regard this combination as a new standard of care for first-line treatment in patients with melanoma.